to Mountain Health Today. I'm Ted Owens, your host. This is a program all about healthcare, produced and supported by the Tahoe Forest Health System. Our guest today is Chief Executive Officer Harry Weiss. And if you would like to watch our programs on your schedule, you can do so at tfhd.com. We'll be back in just a moment with our program. Hello, I'm Ted Owens, your host on Mountain Health Today. Our guest today is Chief Executive Officer Harry Weiss. Harry, good to be with you again. Thank you for coming.
Great to be here and to share with you.
So we're going to talk about a broad array of things today, but a lot of it has to do with growth. You've been with the health system up here 3-4 years, somewhere in that neighborhood, and it's a lot different than what it looked like when you arrived. Why don't you give us a global perspective?
When I first arrived about 3.5 years ago, it was really clear that we had huge unmet healthcare needs in our community. And so one of our 6 critical strategies that the board strongly endorsed and the rest of our team did is really to look at provider or physician services. And I'm happy to share that we made just a couple of minor changes there over the last 3.5 years.
So one of the things I think you had to really zero in on was the fact that baby boomer generation, right? Retirements, folks moving on to new stages of their life. And yet we also have a growing community up here, which you faced as well, in the North Lake Tahoe and incline areas. So you set forth on an aggressive recruiting campaign.
We did, and it really was based on something very simple, and that is, what are those unmet physical or mental healthcare needs that are not being met well at all? And so that started our journey to recruit family practice physicians, to recruit certain specialties, urology, ear, nose, and throat, and others as well.
So really the first step was filling gaps.
Absolutely.
Filling gaps, and the next step would be kind of planning for the future,
right,
and trying to meet the needs that we're missing. It's kind of challenging up here, as a lot of things are up in the Sierra. It's not for everybody. So you're already at a disadvantage on the recruitment swing, correct?
Right, and a lot of people might not appreciate that. We live in one of the most beautiful areas of North America, but probably about 2 to 5% of physicians would want to live here year-round. Everybody loves to visit, but living here year-round takes a special person.
And also, I think that there's probably some skepticism as to the quality of the institution that they're looking at, right? They may not know what you know or what you've built exists.
And so all of those are issues that are important to really communicate and to really make sure that we're doing all that homework up front so that these individuals are going to be a great fit professionally and personally in our community, and we're also looking for people that will stick around for a while and really show the best that their specialty has to offer.
And so now the Lake Tahoe area, South Lake Barton, Incline Village, Tahoe Forest, we like to refer to ourselves as rural.
Correct.
But we're kind of unique. We're a resort community. And so you're not just serving a fixed number of population, it flexes. You've got to be prepared for the big weeks, the big weekends, the visitors that stay all summer as well, right?
Right, and our core population year-round is probably in that 35 to 40,000 range of year-round, but then, as many suggest, it can pop up to 140,000 or 120,000, certain weeks or weekends of the year, and that poses a really special challenge to any health system, even if you were in an urban area.
So you had to spend, I would imagine, considerable time designing your tactics to go about recruitment. meeting the existing gaps and then planning for the future and being able to flex at the same time.
Absolutely. And also, when you're talking to these folks, many times the greatest surges in volume are, guess what? They're on holidays or on a weekend, so from a work-life balance perspective, these providers have to be especially dedicated to their community because they're called upon at the greatest intensity levels when people are on holiday or it's a holiday. And that's not necessarily typical in many communities.
And on the question of quality is very, very high.
Absolutely.
When your recruit targets learn that, do you get a strong sense that they want to be a part of what's happening up here?
I do believe that the review of our quality and our commitment to quality, that it is real. It's not words. It is a walk that we are committed to, that has helped to partially propel us with the recruitment successes we have been able to achieve over the last 2 or 3 years.
Well, we're going to talk a little bit about that growth in just a moment. It's been quite a trajectory for you. I also understand that we'll have some discussion. You've got some folks that have either returned to the area, they've got some interesting stories, but we also have some young providers that have found their way back to the Lake Tahoe area.
Absolutely.
And that's got to be kind of pleasing and exciting at the same time.
Really exciting, and I think it's exciting for our community too.
Oh, I think so. I think that there are names that are recognized, and we're going to try to shed some light on all names today and talk a little bit about how that's impacted the community. One thing I think that's very important is their involvement in the community when they get here. I'm talking with Harry Weiss, CEO, Tahoe Forest Health System. I'm Ted Owens, your host, and we'll be back in just a moment. And welcome back to Mountain Health Today. I'm having a very interesting conversation with CEO Harry Weiss of the Tahoe Forest Health System, and we're talking about recruitment of healthcare providers, physicians, and growth of the health system. We know the community has grown, Harry. That's been very obvious to any of us who have been around for a while. And what comes with that, of course, are greater demands for services that may not have existed, convenience, professionalism, quality, all of that.
Sure.
So what was the size of your provider corps when you arrived 3.5 years ago?
When I arrived, we had, if we look at active and courtesy physicians, physician assistants, and nurse practitioners, we had 115 total providers. Today, what would you guess we have?
I'm not going to guess, but it's a bigger number.
Approximately 150.
That's quite a bit of growth in a short period of time.
And we really just, we started huddles, daily huddles, more than a year ago, and every day we would look at the backlogs of specialties, how many weeks out or appointments or next appointment, and that whole process of doing that 1 to 2 years ago really helped to really pinpoint, that we just can't have those kinds of backlogs continue, because great health care, if it's 2 months out, is that really great health care? I would suggest no.
So, and your huddles consist of your leadership staff, key
Correct.
personnel and staff,
Right.
Trying to fill those gaps and actually benchmarking off of yourselves
Right.
what the situation is. How many patient visits were you looking at back then?
Our health system had approximately 46,000 provider visits in 2015.
Does that include the Incline Village Community Hospital?
Yes,
as well? Okay.
And it's grown just a little bit to today.
Where are you at today?
Almost 80,000 provider visits per year today.
Closing in on doubling it.
Yeah.
And that is, well, it's attributed to a couple of things, I think, I would guess. Number one, filling gaps.
Correct.
Provision of new services, or services that left because it's rural. And then more efficient scheduling and accessibility for the public.
Right, really helping our physicians and nurse practitioners and physician assistants to have a much more efficient day. We've brought in a whole support structure of leadership to really help them so that we're really showing the real value of that part of our team and our health system.
And you're not done growing yet, because I know that in a past program we talked about the 7-day-a-week primary care clinic that's available. That didn't used to exist before.
Right.
So those were visits that just didn't happen.
Right.
Or they would go to the ER, which is less desirable. But you're also working on some new changes along the clinic lines.
Right.
Why don't you share with me?
We have just a huge area of emphasis for us is in mental health. And so we added Mark Cross, who's a very experienced mental health physician assistant, has many, many years, licensed clinical social worker, and then a physician assistant. He works closely with a psychiatrist, and so that really helps us across a broad array of mental health activities, and also opioid addiction kind of issues as well. And so we're really pleased to have that in mental health.
But that's a beginning on mental health, right?
Just a beginning.
Because that's a big issue nationwide, and this is the first step within our community along those lines. Very good. Tell me a little bit more about family practice. So we have that 7-day-a-week clinic, but you're chasing a rural health.
Right. One of the things that we're really, as a strategy, is we're hoping to have eventually within 2 to 3 years 4 rural health clinic sites. So this would be on the second floor of the Incline Village Community Hospital. It would be in the old Gateway Center location, 10978 Donner Pass Road. It would be our 3-story medical office building on Donner Pass Road, and also at least the upper floor of the cancer center on Donner Pass Road.
So the campus is really transitioning from being a hospital campus, the definition that most of us grew up with, to really a health system campus.
Absolutely.
That are serving the public.
How can we focus on your holistic physical and mental health needs, and again, keep you out of the hospital to the maximum degree possible?
And have you been able to keep up with housing all of the providers that you've been recruiting?
We're really tight, but we have to date.
Okay, but you have plans, I would imagine.
We do have, as we speak, construction underway on the 3rd floor of our 3-story medical office building to have a greatly enlarged pediatric footprint, and the whole 2nd floor of the cancer center is under construction for a greatly enlarged patient and physician care treatment space as well.
And there will be more needs to come as the
absolutely more beyond that
continues to grow. So, we're going to take a break in just a moment, and we're going to come back. I want to talk a little bit about some of the physicians that you have, brought on board and who they are, and some human interest elements with some of them. I think that's pretty fascinating. We're talking to Harry Weiss, the Chief Executive Officer of the Tahoe Forest Health System, and this is Mountain Health Today, and Ted Owens, your host. We'll be back in just a couple of minutes. watching Mountain Health Today. I'm Ted Owens, your host. My guest today is CEO of Tahoe Forest Health System, Harry Weiss, and we're talking about some of the incredible growth of the health system over the past 3.5 years, closing some gaps that were missing in the community in terms of services and providers, as well as building up a cadre of providers to meet the needs of the future of the community. Harry, we know our community is growing in population. The Truckee-North Tahoe incline area, very popular place for people to settle now, as well as I know you've built relationships with some of the hospitals to the north because we have such an array of services at Tahoe Forest.
Absolutely.
And really trying to meet a lot of needs. But let's talk about some of these providers that you have successfully brought on board. You mentioned earlier Mark Cross, a PA for behavioral health.
Right.
He's busy.
Very busy.
Very, very busy. You're going to build some more on that.
Right, and we've just reorganized his practice with support people so that we can actually double the number of patients that he can see per week and per month too, because the demand is so great. And I think just one overarching theme as we go through a few physicians is that in most all cases, they're all very busy early on in their arrival in our health system.
Well, and I know that one of the things that you push is physician and provider outreach in the community. I see Mark in the community as well, and he's really working hard to integrate himself, doing a good job of it.
Right.
One story I really like is Dr. Michelle Kim, and she is a family medicine doc, and she's in the Incline Village Community Hospital, but she's come back. This is home for her, right? Share with us her story.
Really special. Many years ago, had to go away to school and came back, and we have other physicians who have been around a few years, not necessarily on our recent edition list, but we've got more on a recent edition who have come back. But it's always special when somebody went away, became educated, even had their practice for a few years, and then came back. And that's the story of Michelle Kim, a very beloved physician in Incline Village. We have Sasha Musso, a physician assistant who accompanies her over there, and the Incline Village community is just raving about her there. And watch for news down the road. We're going to have another physician join as well.
Well, Dr. Kim has just made a name for herself in very short order. Very good to see. One story I really appreciate is Dr. Catherine Colpitts. Dr. Colpitts grew up in the area, I think the Olympic Valley area. Her dad is a dentist, if I'm not mistaken.
Correct.
And she did all of her work, her education, her residency, with the goal of coming back. She found her way.
Yeah, and virtually all of these physicians had multiple offers, so competitive environment. This was true for Dr. Catherine Colpitts as well. And I even told her dad one day, as he had me in the dental chair, that we're going to work hard to get your daughter back here to come back home, and we were successful.
Was that before or after he was set to drill?
Just before, I think. But at any rate, he was very grateful. We were going to try to assist with that. But the community loves her, and just really happy to have her as a family practice physician who's come back home.
Sometimes we'll have a provider like Dr. Semrad, an oncologist.
Right.
And his wife is a doctor also, and she's made the leap of faith.
Yeah, Dr. Allison Semrad, Tom's wife, is an endocrinologist and highly skilled. Has been working at UC Davis, and so we're really fortunate to have her join our community in 2019 as well. And the communities and our team is really anxious to see her.
So I've heard that Dr. Raka rocks. What does that mean?
She is viewed as a superstar kind of physician. I think people have been amazed just how super busy she's been almost from day one as a gastroenterologist, and a highly energetic, highly skilled physician who had a extensive practice in the Reno area and decided to join us, and her time will continue to grow with us over the next few years as well.
Well, I think one of the things that I'm picking up is this emerging theme of community. And
Absolutely.
so you must be doing something in your recruitment that lets them know that you're not just punching in every day, that you're joining a community here, and that's a very important component. Yes.
And it's an exciting team. Our focus as a health system is really being a team of one across our entire health system as well. And that's an exciting concept to be a part of.
And you're not done yet. You've got
Not
more to
done.
build, more to build. So I think that it's very important that that physicians become engaged in a community. It helps better enable them to set roots as well
Right.
for their family. Too often we see sometimes folks think this might be the environment for them. They get here and maybe it isn't, but you seem to be implementing a lot of other reasons to be here other than just the mountains and the snow.
Yeah, it's a good screening, and it's also, being able to really find the right people. And then I do believe quality attracts quality.
Absolutely. Well, I don't think that the quality of the folks that have joined your team recently would be here if they didn't recognize that they were joining a quality team.
Right.
So I think hats off to your successes and good luck in the future. I don't think we're going to see our community not grow. So. You've been watching Mountain Health Today. I've been having a conversation with our Chief Executive Officer, Harry Weiss at the Tahoe Forest Health System, growing our healthcare community in the North Lake Tahoe area. Thanks so much for joining us.